Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned obstetrician and gynecologist, Dr. Parimala Devi, who is a robotic surgeon as well as a Guinness World Record holder in scanning the CS cervix. But she is more worried about the birth defects because today it has become very rampant. Out of 1,000 births, almost 70 to 80 children are being born with the birth defects. And January happens to be the National Birth Defect Prevention Month. And hence, we have to give importance to the prevention rather than treating once the children are born with the defects. So, welcome, Dr. Parimala Devi. Please tell us why these birth defects occur and how do you prevent them?
Thank you, madam. My respectful pronouns to you. It is a very important discussion we are into, madam, because the birth defects, whatever we are seeing some 3-4 decades ago, now also, there are variety of birth defects now also we see, even though we used to see some major kind of defects like some hydrocephalus or some achondroplasia babies or a baby with a cardia outside, with the heart seeing outside the chest, or some babies with the cleft palate. But now there are some syndromes like there can be multiple defects. But why this birth defect is increasing? For that, there are many reasons. But as obstetrician and gynecologist, our duty is to see that a couple, when they come for conceiving advice or they want to go for a pregnancy, we have to screen them and we have to see that they have any kind of risk factors which will lead to the anomalous baby,
like
or some babies with some defects,
genes on either family.
Defective genes, anything. So it can be environmental defect, or it can be genetic defect, or it can be structural defect. Structural defect means what I was telling, like cleft palate and all those organs which they are not developing, or there can be some intestinal problems. But for this to know, as soon as they come, we cannot tell them there may be birth defects, so you have to be careful. We have to assess at what age this couple are there, whether they are in the extreme age of some 40 years and all, sometimes they want a pregnancy, they get married late and all, or they are in the very younger age group where there are a lot of twins babies forming and they may have some congenital union of the twin babies, the conjoined twins and all can happen. So we have to assess their age, any risk factors in the family, like is there any like a recessive autosomal, some blood disorders in the family, any baby, any child which has
like
grown with some muscular dystrophy, thalassemia, that is the chromosomal, or Down syndrome, where the babies are sometimes mentally retarded. So such babies, we have to take the proper history on a girl side also, the husband side also. Other than that, what is the weight of them? They have to develop some culture like Garbha Sanskar, what we speak. They have to be very careful what diet they are taking, their way of their habits, any smoking, any alcohol. You know that these days even in women the smoking has increased and alcohol has increased. So all these things can bring lot of defects in the growing baby because their genes and epigenetic changes can happen. And so because of this proper history taking and assessing, especially are there any drugs they are taking, especially if the girl is taking some kind of tablets for recreation or for any other reason, if she's on
like
some
anti-epileptic
drugs,
depression or
sleeping
epileptic or
tablets,
depression.
anti-epileptic drugs, and also diabetes. If the diabetes is not controlled, asthma, especially diabetes, if they start the pregnancy with severe hyperglycemia, definitely this cleft palate and so many abnormalities are very common in babies because we are diabetic capital. So we have to be very much knowing that whether the pregnant lady is having high sugars, what is her HbA1c, that is which determines her capacity to pregnancy and taking it forward, and these asthmatic drugs because there can be steroids. They
and
may be giving her steroids, but hyperthyroidism. All these conditions like we'll have to know, and also the thalassemia trait is also one common problem. Some parts of our country, India, the east region, and all, we have thalassemia trait, and even a rubella can be there if they are already infected with that virus.
But now the rubella has come down because the government is giving free of cost all rubella vaccine to all their children. So now it has come down compared to what it was 10 years back.
Yes. Most of the diseases have come down, but still it's our primary duty for the gynecologist and obstetrician to see that any of these defects are going to come because of this habit in that couple, we will have to alert them. Now only you correct your this one. Give some time, and then you can give up your habits. Then you can conceive. And if there are hereditary chances of this one, then we have to definitely send them for the genetics
Genetic
specialist
counseling.
screening test, because counseling, because they are going to see the pedigree wise, they are going to assess whether it was there in their first generation of grandfather, grandmother generation, then the father, mother, then this generation, so that they will come to know where exactly any problem is there, or they are quite normal to go ahead with the conceiving. So these
Okay.
tests are very important. We have to make them understand these tests are available. You go
Yeah.
and get it done.
When do
Otherwise, they
you
will not
when
know
do you
anything.
when do you do this test? At what stage do you do the test?
Yeah. Usually, especially pre-conceptional counseling only, we usually send them if there is any doubt that in their family there are some doubtful cases of abnormality, maybe mental retardation, Down syndrome, or at least if their age is very high, they have gone through the IVF to get the pregnancy. There also will have to send them for the genetic counseling, because the further pregnancy chances, everything they have to assess and come. Other than that, any autosomal recessive diseases are there in the chances of these people. That time also this genetic counseling will definitely help to prevent some of the birth defects, definitely into that couple. Other than
Okay.
that, ultrasonologist, the intervention radiologist, what sonology they do once a patient conceives, I'm telling, a third month scan is so important.
Very
It's an
important.
early anomaly scan. Yes, yeah, by chance if they have conceived and they have come, at least that scan will confirm that they don't have that neurological defects, because that NT measurement what we do, double marker test what we do, wherein that beta HCG and PAP, some hormones are detected in the blood of the pregnant mother. All this will prevent, at least if there is some doubt, oh, this baby is going to develop some Down syndrome or some neural tubal defect, we can again immediately, we are not going to terminate. We have to counsel and get some other test to top up these tests. And again,
Okay.
another anomaly scan can be done. Double opinion
Okay.
can be taken. Again, with the cardiologic, pediatric cardiologist may be there. They may assess the cardiology status
What
of
is
the
what is
baby.
the what
Do-
is the age when you terminate? Is there any particular
Usually,
thing? Otherwise, it will be very riskful. Yeah.
yes, usually up to 20 weeks, it's already medical legal, the license is given for the termination in India. But if there is an abnormality of the baby, it's however careful they were, there was some abnormality diagnosed, which is not compatible to continue the pregnancy. Because if that baby is born, then also it is going to not survive. That time it will be usually 22, but actually 24 weeks also the court has declared, but that
Declared.
amendment is yet to come. But now up
Okay.
to 22 weeks, we are undertaking any abnormal baby is there.
Mm.
Otherwise, it is 20 weeks is the cutoff. 12 weeks and
Okay.
20 weeks is the cutoff.
Mm.
So
Mm. Mm.
because we don't want to give birth to the couple to birth to a baby which is unable to walk, unable to speak, and
Mm.
unable to do anything in the life with its health issues. So these are all
Okay.
things, especially the pre-conceptional screening has become really very important as the pregnancies of advanced age are
Mm.
increasing these days because of the late
Okay.
marriages,
Okay.
and also
Oh,
because of the drugs and the smoking habits.
and
So these are all
drinking.
the things like, yes. So
And
it is
is there
something a discipline.
any drugs are available to prevent these
Yes,
defects? What advice do you give them?
yes. Yes. When in the beginning only when they come for the counseling, it is our utmost duty to see that are they taking the folic acid tablet, because
Mm.
folic acid is a vitamin which will prevent a lot of abnormalities, especially neurological defects. That is NTD, neurological tubal defects like spina bifida, or if there is a hydrocephalus, because anencephaly, only half of the head will be developed. That is nearly about 22% in our country. So
Mm.
because of that, the folic acid has been found
Very
to
high.
bring down
Okay.
most of the neural defects. So about 400 microgram of folic acid is given every day before they go for pregnancy or when they plan for pregnancy. And
Mm.
then it will be increased to 5 milligram every day for at
Mm.
least 3 months. The first three
Mm.
months when the
Mm.
organogenesis happens. This will definitely some 70% reduction in the abnormal, especially neural tubal defects are reduced because of the folic acid and some of the other abnormalities also. So folic acid has been one of the must they should start when they plan for the pregnancy, and they
Mm.
have to develop their good habits of eating good this one sattvic food, garbha sanskar, and all these things should be adopted by them, because
Mm.
they should see that their infection rate also comes down,
And
and they
also
have to,
no
because
junk
there will be a
food.
lot of
What
epigenetic
about the junk
changes.
food? Junk food.
Junk food. junk food, that also can definitely bring lot of gastrointestinal problems also, and also it can change a lot
Obesity.
of yes, obesity also can increase. All these things actually will bring down some changes in the body, and they may develop diabetes because of
Mm,
everyday junk food and extra eating of the calories and all.
mm,
And definitely obesity, and along with the diabetes, hypertension,
mm,
metabolic disorders will definitely lead not to any good pregnancies. So they
mm,
have to give an attention to all these things, and at times needed they have to take the opinion of genetic specialist, the
mm,
interventional radiologist, cardiac
mm,
pediatric cardiologist, and
mm,
also neurosurgeons, because
mm,
there are some surgeries which are done very advancedly these days. Even
mm,
when the before, even though not in India, in USA, I think we
mm,
all have heard, in the
mm,
during the delivery only they will do some surgeries which are needed for the
mm.
fetus, and they put back the fetus to grow again, even though it is
Okay.
in the pipeline. But soon this will can happen in India also. And some
Mm,
of the interventional therapies, like giving through the amniotic fluid some of the medicines and making the baby more healthy, feet endo
mm,
procedures like that, I also have been spoken of.
mm,
So with
mm,
all these, we can definitely make the couple comfortable to deliver a very healthy child if we take the
mm,
due precautions before
mm.
pregnancy, and with the early pregnancy and all the trimester also. We
Okay.
can make them go ahead with a healthy child birth.
Okay, okay. So you are saying that by finding out whether the soil is fertile, you find
Yes,
out both father and mother whether they are normal or not. And then the seed, whether the baby is all right or not. That also you test. And not only that,
yes,
now the advanced technology is such that you are able to detect even the most difficult, complex congenital defects also. So if they are treatable, you allow the pregnancy. Not treatable, you
yes,
terminate. So you don't
yes,
allow them to abort or have a stillbirth or deliver the baby and suffer later on. So today
yes,
they must have a healthy baby for the healthy nation, and that is the motto. And today, we are discussing this important point because there is a saying: a mediocre doctor treats when there is a full-fledged disease, and a ordinary doctor treats when the disease occurs, and the excellent doctor prevents the disease. So let us all become excellent doctors
prevention.
and see that this birth defect, which are almost 70 to 80 per thousand birth, let it come down to at
Yes,
least 1 to 2, so that the suffering and the unnecessarily expenditure on the treatment and everything will come
right.
down. Psychological
Yes,
thing, everything can be controlled provided we detect in the first trimester itself. So the technology is there, and doctors are expert and they're doing. So the people should understand these things and go to them and
understand.
see that they have the normal. So the gap between the
Yes,
technology and the awareness among the people should come down, and that's how we are observing this national birth defect prevention. And throughout the year and throughout our life, our aim should be to have a healthy baby and a healthy future for the baby. Thank you very much, Dr. Parimala Devi.
yes.
Namaskar.
Thank you, madam. Thank you so much for the opportunity.